I like things like this, Erica, where I learned at the same time the audience does. Finding help through all the confusing terms and studies about hormone replacement therapy is really scary for a lot of people. This nice lady next to me in the white robe is E, the author of the Shmersky, The Pursuit of Hormone Happiness, and she's back with hormone specialist Dr. Melinda Silva as well to sort out fact from fiction. The book was inspired by your own challenges involving perimenopause and menopause. Tell us what you learned that you wanted to share with people.
Well, what I've learned is that many women are suffering with perimenopause and menopause symptoms. Symptoms like sleeplessness, depression, anxiety, weight gain, crashing libidos, and uncontrollable emotions. And the reason women are suffering is because they're afraid of hormone replacement therapy. They don't understand the risks and the benefits, and that's why I'm excited about being here with Dr. Silva, so that she can kind of put a rest to some of that scary chatter that's out there, so that women can get the help they deserve.
And we'll tell you, the reason for the bathrobes is that this is something you should be able to sit around with your friends and talk about. Have a cup of coffee in the morning, shut off the TV set after the show is over, or after the news is over, of course, and just have a down-to-earth conversation with some of your own friends and your own relatives about this as well. What is it that's most scary for people, for women, about hormone replacement therapy, Dr. Silva?
Well, there's a WHI study, the Women's Health Initiative, that really confused patients and doctors and scared a lot of people into taking hormones, because the WHI study showed that synthetic hormones, which was the Premarin from the horse's urine and the Provera, the synthetic hormones, caused breast cancer. So after 5 years of use, it caused breast cancer. So women all across the country were instantly taken off hormones, and they suffered unnecessarily because they didn't know that there was a alternative, which is the bioidentical hormones. The bioidentical hormones has not been shown to increase the risk of breast cancer, but a lot of doctors and a lot of patients don't know that there's a difference. The WHI study didn't study the bioidentical hormones, which are the hormones that I like to give to women, because the bioidentical hormones is just replacing your body with what your body has lost. So it's the exact same chemical structure of the hormones your body makes. So you're just replacing what nature has lost. So there has not been shown an increased risk of the bioidentical hormones, but people confuse them. They think the synthetic hormones are the same as the bioidentical hormones, so they're afraid to take them, so they suffer unnecessarily.
E, in the course of writing your book, did you come across many women who literally thought they were going crazy until they realized what they needed?
Yeah, no question about it. As a matter of fact, it's really important for me to make sure that women understand they're not alone. There are over 50 million women in North America in menopause. Women need to trust how they feel, and they need to reach out and find a perimenopause and menopause specialist, just like Dr. Silva, someone who understands and is up on all the latest data. They need to ask for the tests that they need, and they need to communicate openly and honestly exactly how they feel. And I don't want your listeners to get overwhelmed. I made this simple and easy, like a toolkit, in this book, Shmersky, The Pursuit of Hormone Happiness. I walk you through how to do all of this. You don't have to be overwhelmed, and you can find hormone happiness. I did.
And the fact is, you're not going to get your advice, ladies, from this TV station or from your book. The advice is going to come from a doctor you know and you trust. What kind of choices do they offer? What choices are out there for women right now? This is a great modern time where they've at least discovered these things.
Well, there are doctors that are trained, fellowship trained like I am, in bioidentical hormone replacement therapy, and you should follow up with a doctor like that, because then they know the tests that they can run for you, and they know how to monitor you, and there's a lot of various ways to give the bioidentical hormone therapy. And what we like to do is I customize the treatment for each person. So your treatment is going to be different than your friend's treatment. So it's personalized medicine, which is great. And one of the things one of the myths that I want to debunk is that bioidentical hormone therapy is really expensive. For me, because my mission is really to help people and increase their quality of life, I make it affordable for people, because I want every person who's suffering to be able to afford it. So for me, having it affordable for the person is important. So it's not something that's out of range for people. Some people say they can't afford it, so they don't even try.
Just briefly, how long does it take before they see results? That's probably what a lot of women are asking right now. Does it take a week or 2 weeks or a year or what?
You know what? It's uncommon for it to be a light switch. You take the hormones and then you're like, you're instantly better. I've seen people days to weeks to months. Most people, it's weeks. Most women, they're so thankful because they said, you gave me my life back. I receive letters from husbands that say, thank you for giving me my wife back. Wow. You know, it totally changes people's lives. We get you back to how you used to be, you know, and that's what we want. You know, we want you to be yourself. You know, your families don't deserve a unenergetic, unhappy you. It's going from uncharted territory to charted territory. E is the author of the Shmirsky, not to be confused with the Shmengi, the Shmutzik, or whatever else. The Pursuit of Hormone Happiness, and hormone specialist Dr. Melinda Silva. Thank you both. And you can go to our website, fox5sandiego.com. Click the Scene On tab if you want to learn more. Thank you both for being with us.
Thank you.
And nice bathrobes.
Yeah, thank you.
Okay, back to you, Eric.
All right, thank you.